Transient ischemic attack, TIA. What is a TIA? What are causes of TIA? Symptom of TIAs and how to treat a TIA. A scenario: 87-year-old female comes in with symptoms of a cerebrovascular accident, one-sided numbness and paralysis, irregular speech pattern with slurred words, and a temporary episode of syncope. Pertinent negatives to a cerebrovascular accident: patient regains regular speech pattern on the way to the hospital and regains feeling on both sides of body with no obvious paralysis. Possible TIA. Transient ischemic attack. When a portion of the brain loses its blood supply, it becomes damaged and stops functioning. When a portion of the brain does not function, the part of the body that it controls also stops working. This is called a stroke or a cerebrovascular accident. If the brain is able to regain its blood supply quickly, then the CVA symptoms may resolve. This is known as a transient ischemic attack, or a TIA. A TIA is similar to a stroke that resolves by itself because of a temporary lack of oxygen to a portion of the brain. Causes of TIAs. Loss of blood supply to portions of the brain can occur for a variety of reasons. A blood vessel can become blocked and blood supply to a part of the brain is lost, or a blood vessel can leak blood into the brain, called brain hemorrhage. Most commonly, however, the blood vessel is blocked. The blockage can be caused by a blood clot that forms in the blood vessel, thrombosis, or it can be caused by a clot or debris that float downstream, embolus. Fatty plaque formed in the blood vessel wall is called arteriosclerosis, or hardening of the arteries. Plaque can rupture and cause a small blood clot to form and occlude the blood vessel. Blockage can also occur when debris from narrowing or of the carotid artery breaks off and floats downstream to cause the occlusion. Sometimes in people with irregular heartbeat, called arterial fibrillation, small blood clots can be formed within the heart and travel to the brain to cause the obstruction. The intensity and location are symptoms of TIAs. The intensity and location of the blood limitation to the brain will determine what symptoms will occur as a result of a stroke or TIA. Many people experience confusion, weakness, and lethargy. If the loss of blood supply is in an area supplied by the middle cerebral artery, a classic sign may include weakness or paralysis and numbness of one side of the body. The whole side may be affected or just one limb. Often there is a facial droop. If the stroke is on the left side of the body where the speech centers are usually located, there may be difficulty understanding words or speaking. Partial vision loss may also be a part of the constellation of symptoms. Strokes involving the vertebral arteries decreasing blood supply to the base of the brain and may cause a drop attack, a sudden fall while walking or standing, and then a quick recovery, an unexpected collapse in coordination or difficulty walking. The important distinction between stroke and TIA is resolution of the symptoms. By definition, the symptoms of TIA must completely resolve, and while this most often occurs within the first few minutes after symptom onset, it may take up to 24 hours to have complete return from normal function. Antiplatelet therapy. How to treat TIAs. If the patient was not taking aspirin when the TIA occurred, it usually is started at a dose of 325 milligrams per day. If the patient was taking aspirin, another antiplatelet drug called dipyridamole may be added. Agrinox is a combination of aspirin and dipyridamole. Headache is often a side effect. If the patient cannot tolerate aspirin because of allergy or stomach upset, Plavix may be used. High blood pressure therapy. Even if the patient does not have hypertension or high blood pressure, there may be a benefit in taking antihypertensive medications. The goal for normal blood pressure is 120/80. Cholesterol-lowering therapy. Guidelines recommend that a statin drug be started even if cholesterol levels are normal. Simvastatin or Zocor is the most commonly recommended medication, but new guidelines limit the amount prescribed per day because of the risk of liver side effects. Risk modification. Smoking, excessive alcohol, obesity, and lack of physical activity are considered risks for future smokers. The following recommendations are now suggested. Smoking, counseling, smoking cessation aids like nicotine gum or medications like Chantix should be considered. Environmental smoke should be avoided. Alcohol intake should be limited to 2 or fewer drinks a day for men and 1 or less for women. Obesity. Overweight people should try to lose weight using a combination of diet, exercise, and counseling. The goal is a BMI of 18.5 to 24.9 and a waistline of 35 inches or less for women and 40 inches or less for men. Exercise. 30 minutes of moderate exercise daily is recommended for those who are able. For patients with disabilities, a tailored exercise program to their capabilities should be arranged. This is my presentation on TIAs. Thank you.